Hello, everyone. My name is Alexander Nam, and I am a law clerk here at Lowes Parker. Welcome to today's webinar hosted by the Home Care Association of Louisiana. Today's webinar is entitled Building from Baseline, Practical Advice for Strengthening Your Home Health or Hospice Compliance Program. Today's presenters are Heidi Kocher and Robert Saltaformaggio. Heidi Kocher is a partner with the law firm of Lowes Parker. She has over 20 years of experience advising and defending healthcare clients on legal and regulatory matters affecting providers of all sizes. She's an expert in all aspects of compliance and privacy programs, including developing and deploying policies, procedures, and training. Her experience includes serving as a chief compliance officer and a chief privacy officer, implementing the various requirements and aspects of corporate integrity agreements, and responding to and defending audits from Medicare, Medicaid, and private insurers up through the ALJ level. She received her JD from the Georgetown University Law Center and is licensed in Texas and Maryland and admitted to the U.S. Court of Federal Claims. And she is certified in healthcare compliance. Our next speaker, Robert Saltaformaggio, is a senior counsel here at Lowes Parker. He focuses on regulatory healthcare compliance matters, fraud and abuse, and reimbursement issues. Robert represents clients nationwide. He has experience in assessing client records for documentation compliance and private payers and CMS audit preparation, as well as identifying and improving documentation deficiencies. He received his JD from George Mason University and is licensed in Virginia and Washington, D.C. Quick reminder, if you have any questions throughout the presentation, feel free to type them in the chat box and we will address as many as possible at the end of the presentation. Without further ado, I present your speakers, Heidi Kocher and Robert Saltaformaggio.
Thanks,
Thank
Alex.
you so much. Go ahead, Robert.
Yep, go ahead, Alex, to the next slide 3. Before we begin, we just want to have our general disclaimer. Anything Heidi and I speak on today is just general information. Any legal advice, strategies, or outcomes can vary greatly depending on your specific facts and circumstances. So whatever we say today does not constitute any legal advice or create any attorney-client relationship. If you do believe you need legal counsel to represent you on any particular matter, we recommend you seek out and hire competent representation from a licensed healthcare attorney in your state. Next slide. So this is an overview of the issues that Heidi and I are going to talk about today. I'm going to go ahead and start discussing the first steps in building your home health and hospice program, as well as your first lines of defense. And then Heidi will come back and on the back end and review kind of a lot of the legal matters that can, might be applicable to your particular situation. Next slide. So the basics here, when you're developing your home health or hospice program, you really want to know who and what you're dealing with and know, the legal environment in which you're getting engaged. And both home health and hospice are subject to a number of federal and state laws. At the federal level, the particular laws that we often want to highlight is the federal anti-kickback statute, the Stark law, any penalties such as civil monetary penalties that arise, and of course we're all familiar with HIPAA. At the state level, and in particular in Louisiana, there are 2 statutes that are of particular importance: the revised statutes, Titles 40 and 48, and the Administrative Code, Title 48, Chapter 91. And then even outside the government regulatory scheme, whenever you're dealing with private payers or outside third-party companies such as billers or skilled service companies, you're going to have your own individual contracts with those entities that are going to structure your engagement and how you're going to move forward. Next slide.
Alex, can you switch to presentation mode, please?
Yep. Oh, thank you. Yes.
Thank you so much.
Yeah, perfect. Thank you, Alex.
Of course.
So let's start. Let's kind of start on the back end. What happens if something happens? And this can be anything from a government entity showing up, or you're dealing with a private payer or another type of third party. You know, the first step is don't panic. Take a deep breath. Everything that you're going to do up to that point, which we're going to talk about in a minute, is going to help prepare you for success. But just in case something does happen, you know, first you want to know with whom and what you're dealing with. Especially if it's any type of government entity, you want to make sure you get any identification to determine whether it's a federal authority or state authority. And then, you know, if they're coming to do an on-site records request, or, you know, with a subpoena requesting any type of records, you want to make sure you get a copy of that official documentation, and also review, you know, what items are being requested to submit. You know, you want to make sure that you do contact an attorney if you have representation, because, you know, licensed professional attorney will be able to help navigate you through kind of the complexities and the unease that can come about with kind of, you know, either a records request or a subpoena. And then when you do produce any documentation, you know, again, whether it's to a government entity or to a private payer, you want to make sure that you maintain copies of anything that you submit to those entities, because heaven forbid on the back end, you know, that entity makes a declaration that, hey, I didn't receive, you know, the patient record for, you know, Mrs. Smith, or I didn't receive the orders for, you know, Mr. Jones. You're going to be able to point to, you know, that copy of the record that you sent. And, you know, especially you also want to make sure that you retain copies of any tracking information if you submit records, you know, in the mail or via Federal Express or UPS. So that's important to make sure you have copies of everything. And then one thing we've also noticed on the back end that a lot of insurers are doing is that, you know, insurers often have what I would kind of equivocate to professional liability coverage, that if you are audited or have to deal with, you know, some type of legal matter in regards to, you know, the provision of your services, they oftentimes have like coverage for these, you know, any payments doing it. So, you know, if you are, you know, forced to hire an attorney to represent you in any type of matter, that insurance can cover up to a certain dollar amount in those payments, and it'll just be part of your insurance contract. So oftentimes we recommend to our own clients and to other providers with whom we've spoken to, you know, one of your first steps should be to check in with your insurer to see if you have any coverage that would help assist with paying for those funds. And, you know, finally, above all, you can't ignore a problem like this. You know, if you do receive a records request or a subpoena, you can't just, you know, act like an ostrich and stick your head in the sand, because, you know, especially with a government entity, your response and timely response is going to be required. And you want to make sure that, you know, you keep an open and positive relationship and communications with any of these entities, because it's just going to make the entire process so much smoother and easier for you throughout. Next slide. So that's kind of on the back end. Let's talk about what you should be doing, you know, when you first either establish your home health or hospice agency, or even if you've already done so, what you should be doing now. And that's to create an effective and strong compliance program. That should be the basis for any business, especially those who are engaged in the healthcare industry. And how do you develop a strong compliance program? Well, that's through the 7 elements of an effective compliance program. You might be familiar with these, but I still want to highlight them. First, you want to make sure that you have written standards of conduct, policies, and procedures. And again, the emphasis there is on written, because you might have some you know, policies and procedures that are informal, that you and your providers or your employees know and discuss about, you know, talk about by the water cooler, but if it's not written down, it's not applicable. Number 2, you want to designate your compliance officer, and if appropriate, given your size, a compliance committee. Because that individual and the committee is going to help oversee and really implement and affect an effective compliance program. 3, you always want to make sure you're conducting effective education and training. And, I always recommend it's done yearly for those established employees. And for any new hires, I recommend, making the education and training part of the onboarding process. And again, with this training and education, just like the conduct and policies and procedures, make sure the training is written down and that you kind of maintain attendance rosters, because if you are audited or receive some sort of legal subpoena and the government asks for who was trained and when, it'll behoove you that you'll be able to produce, here's the training materials we gave out to our employees, and here are the dates, and here's everyone who attended. So you want to make sure those are written and that you have attendance rosters and copies of the education provided. Number 4, you want to make sure you develop effective lines of communication. And this includes, ethics hotlines where any of your patients or your relatives can report any kind of complaints, and that you can take those complaints, whatever they may be, and review them and act on them if necessary. Number 5, you want to enforce all of your written standards and policies, procedures through well-publicized disciplinary guidelines. And again, like everything else, these guidelines should be written and available to all employees so that they know, if they mess up or if they do something wrong, this is going to be the consequences for that misbehavior or their actions. You also want to make sure you're conducting internal monitoring and auditing. And this really should be an ongoing process because it's going to help develop and really make your compliance program better. But it's also going to make sure that if you're able to identify and correct any issues internally before you have either a government contractor or a third-party contractor come in and do their own audit and then assess an overpayment or other kind of adverse legal consequences. It's always better to do it up front. It's going to cost less. It's going to, whether that's in money, in your own time dealing with these issues. And then finally, you want to respond promptly to any detected offenses and develop corrective action processes. And that really kind of follows on from number 6. So when you are doing that monitoring and auditing, you're identifying any issues that arise, and then you take action on those issues. Heidi, do you have anything you want to add on the 7 elements?
Nope, just that people often think they have all of these elements, but they really need to make sure that it is thought out and organized, and as you said, documented.
Yeah, and sometimes there might be quick compliance programs that you can find online that can be helpful as kind of a starting point, but you really need to make sure that you scale any compliance program to your specific business, because everyone is going to have different requirements. Your size of your business is going to be different, the number of employees you have. So you can't just take these prepackaged compliance program models that you find online and just stick it in your office and say this is good to go. Those can serve as kind of a skeleton, but then you really need to go in and add the meat to it so that it's tailored and scaled to your particular business. Next slide. So over the next couple of slides, I kind of just want to highlight some of the risk factors that we've seen for home health agencies, and that really kind of arose from the Federal Office of Inspector General at HHS and their compliance program guidance. One thing I just want to flag right up front is the one found in red there, the insufficient documentation of medical necessity. The OIG flags this as their _1 denial, and it's really what I've seen in representing clients as, the biggest denial in prepayment and post-payment audits. It all focuses on insufficient documentation of medical necessity for the home health services that are provided. But, I also want to flag, the first couple bullet points, those related to issues that could arise that would violate the anti-kickback statute or the START self-referral law. Those kind of issues are really going to be where you get into legal trouble, that you're going to really need some competent legal counsel. I've also seen a lot of issues with insufficient documentation regarding the homebound necessity. As everyone knows, for home health, the patient needs to be certified that he or she is homebound, and there's been a lot of issues with failing to do so, either in the face-to-face document or in subsequent medical records. An auditor will find that the skilled nurse or whomever, or the therapist would record that, oh, the patient was able to walk out of his house and drive to the store, and that can sometimes be on an infrequent basis, but it's going to create issues when there might be repetitive notes in the patient record, and then how is the auditor going to be able to substantiate that the patient truly was homebound? Another issue, billing for items or services not rendered. I mean, that's pretty straightforward. You don't want to try and get the juice from, squeeze the juice to try and get a few extra pennies there for services that are not rendered. You want to make sure anything you do, you're properly documenting and then billing for the appropriate services that you do provide. Next slide. Just a _1, another list here. From my experience, bullet point _4, billing for services provided by unqualified or unlicensed clinical personnel. I see this issue a lot, that the personnel who you've engaged to provide particular services might not be licensed, or might not be appropriate license. If you're working with a skilled nurse who might be licensed in, let's say, Texas, but has not obtained his or her Louisiana license, and or there's no reciprocity for those services, well, then you can't accurately bill for those services. And one thing that might not be on here, I would say unqualified, is also individuals who have been excluded, which I believe Heidi will be talking about later. Not billing for persons who are excluded from participating in the Medicare program. Falsifying your documentation, whether it's plans of care, the skilled nursing notes or therapy notes, that's going to always create an issue. Next slide. Just some more here. I think the last bullet point is really important: failure to return known overpayments by federal healthcare programs. When you're performing your monitoring and auditing, internally, and you do identify an overpayment, you have 60 days to return that identified overpayment back to the government. So you want to make sure that you are doing so on a timely basis, because in some of these audits, if you ever have them, especially the post-payment audits, if there's a high error rate, let's say you're a Medicare participant, and I'm sure this would have affect at the Medicaid, the state level as well. High error rates can be problematic because they can affect your ability to bill to those federal programs, and it can also lead to suspension of your billing privileges or even revocation. And that's just going to create a whole bunch of issues going forward. So again, just circling back to the 7 elements, having that effective auditing program internally and taking action on any issues you find is just going to help reduce that error rate, so that you don't run into, those suspension or revocation issues. Next slide. Just wrapping up here, improper referrals by hospitals that own either home health or hospice agency. I think that's going to create some really, problematic legal issues. I think a lot of these are pretty straightforward issues. Heidi, anything you wanted to add on any of these home health agency issues that you've experienced or seen that have been problematic?
I think you've covered most of them. The only thing is occasionally a routine waiver of co-payments. That comes up so often.
Yeah, you can have some charitable services that will really be patient specific, but when that becomes a routine part of your business, that's going to create some problems. Next slide. So now some risk factors for hospices. A lot of there's going to be some similarities with regard to hospice as with your home health agencies. One thing that I'll just flag that's going to be pretty straightforward is, issues surrounding admitting patients to hospice who are not terminally ill. Anytime I've had clients, representing them in the appeals process, this is going to be the number one stickler for why claims are denied. Especially for these Medicare contractors, which a lot of the private payers, they follow their guidelines, whether they're through the local coverage determinations or even if there's a national coverage determination. Each of the regions are gonna, and the Medicare contractors are gonna set forth the guidelines on, what a patient and his or her clinical condition must show in order to be certified as terminally ill, and especially if it's that patient is being certified with a specific terminal illness, whether it's Alzheimer's, dementia, whether it's related to cancer or heart disease. They're going to set forth those specific guidelines. And if you're admitting a patient for hospice and your hospice director is certifying the patient as terminally ill, you really need to make sure the patient and that beneficiary is meeting the guidelines promulgated in those local coverage determinations. Otherwise, if you're working with Medicare, their contractors are just going to deny the claims, and you're going to have to spend time and money fighting and going through the audit and appeals process, trying to show how the patients were terminally ill. Also, kind of that last bullet there, as folks who work in hospice know, when you certify a patient as terminally ill, it means that the patient is expected to, be deceased within 6 months, assuming that the terminal illness runs its course. Now, we all know that just because you're certified with a terminal illness doesn't necessarily mean you're going to die within 6 months. It's just it's expected to, assuming the disease runs its course. While government contractors and private payers know that patients can proceed through several benefit periods on hospice care, they're going to start really paying particular attention when those hospice benefit periods become extensively long, when you're running into 6, 7, 8, more than 10 benefit periods. That's really going to raise a red flag on whether is that beneficiary truly terminally ill. So you want to make sure that as the benefit periods progress with each patient, that the scrutiny you and your team and your medical director and your IDG group put forth are becoming tighter, because you want to make sure that the documentation really supports that the patient is terminally ill based on those guidelines. Next slide. Again, like we flagged with the home health, all this incentives related to referral sources that could violate the anti-kickback statute or any other federal or state law or CMS rules can be really problematic. Next slide. You know, again, billing for that hospice care, if you know your workers are unqualified or unlicensed or excluded, false dating of any of your records, either to support the certification or recertification, or you know once you get into that third benefit period, performing the face-to-face encounter, you know, making sure that everything is timely, that you know, you're going in the order you should. If you can't, you know, if you're in that third benefit period or after, you can't do the certification or the recertification before you do the face-to-face encounter, because the details that are outlined in the face-to-face encounter are used as supporting evidence and facts that you put forth in the hospice certification. Okay, that's kind of what I want to focus on the risk factors. Heidi, anything you want to add on the hospice risk factors?
Yeah, so the only thing that I really want to add is that, remember, just because you have somebody on hospice doesn't mean that if they show improvement that you can't take them off of hospice. And sometimes discretion is the better part of valor, and for the appropriate patient, you know, who maybe is not progressing, and where there is possibly some question about their qualification for hospice, you might want to think about whether or not it's appropriate to remove them from hospice.
Yeah, I mean, I've definitely seen that in various audits where, you know, even if the patient, you know, appears to be terminally ill, if there's been no digression in his or her clinical condition, oftentimes these contractors or private payers will, you know, claim that, you know, hospice services weren't medically, you know, necessary because, you know, the patient has stabilized. So in that case, like Heidi said, if you know, that's kind of when you want to have that internal discussion on whether or not, you know, ongoing hospice services are really necessary. Great, thank you, Heidi. Next slide. So this is just some updated general compliance program guidance that was issued last year. It kind of just discusses, you know, some compliance program guidance that are going to be applicable to all provider areas. And then, you know, it came with industry segment specific guidance, whether it's in hospice and home health. You know, many of the sections that were in this guidance dealt with the overview of federal laws. It reiterated the 7 elements of an effective compliance program. It discussed, you know, whether you're a small or large entity, how to adapt these compliance programs to best fit your, you know, your business, and kind of just talked about other compliance considerations. So that's kind of just a great link if you want to explore more information that the federal government issued to help, you know, with your compliance program. Next slide.
And
Yep.
Let me just say that with these updated general compliance program guidances, the government has really tried to bring the compliance guidance into the 21st century. As you saw from the prior slides, the other guidances date from the late 1990s. So even before we hit Y2K, year 2000. So those guidances are very old, and what they've tried to do is try to update and modernize it with the general compliance program guidance. The industry-specific guidances for home health and hospice will not be out for probably another 18 months or so on. So the prior guidance is still in effect, but again, go ahead and look at this general approach and see what gleanings you can have in it, particularly on the adaptations for small entities.
Great, thank you, Heidi. Yeah. Alex, next slide, please. So our boss, Robert Lyles, kind of developed what he calls the 8 elements of a payable claim. And as you can see, all these elements, the ones, you know, really important to highlight are elements 1 and 5. And everything is based on and follows element 1, which is that the medical service or supplies provided were medically necessary. And again, that's the number one issue we see with audits, whether it's government entities or private payers. Were the services, were the supplies rendered medically reasonable and necessary? And element 1 is provided by, is kind of supported by element 5. Even if the services or supplies rendered or provided were medically necessary, were they properly and fully documented? I mean, that's kind of the basis for any, a lot of things with compliance, whether it's your policies and procedures, your, internal audits and corrective action programs, and then here with, payable claims, where the services rendered properly documented. If they weren't, well, then you're not going to get paid. Claims must be documented from the view of a third party who knows absolutely nothing about your patient or their history. Only that document, the claim form and the medical records will be in front of them. So, if all of the services and all of the information are not in those records, that payor is not going to be able to reimburse you for the services you provided. So that's what you want to make sure that you're doing. You're providing reasonable and necessary services, and you're documenting that you're doing so. Next slide. So here, we kind of just wanted to talk about developing a strong billing contract. And even though this the next couple of slides focus on, implementing a billing contract, that you might have with a third party, some of the terms and the guidance we'll talk about will be applicable even if you do your own in-house billing, because you're oftentimes still going to utilize third parties for some type of service, whether that's a skilled service or some kind of supplies. You're going to have some sort of contract with that third party. So whether it's a billing contract or other contract, you should make sure that those contracts are addressing as many of the potential legal issues that could come about. And then you're going to do so by delineating each party's rights, obligations, and remedies. Some of the examples, the provision examples that you'll have in these contracts are termination provisions. So, whether or not you or that third party, operates outside the terms of the contract, how either party might be terminated. And if so, are there any adverse actions or repayments that are going to have to be made? You want to make sure you have provisions related to the handling of requests for refunds, whether that's from a payor that's coming through and doing auditing. Who's going to be responsible for credentialing? If you do utilize a third-party biller, is the biller and his team, are they going to be responsible for credentialing their employees? Or, if you run it in-house, that's going to be on your own onus to make sure that your team is credentialed. Any information or documentation, let's say you get audited, is that documentation going to come directly from you? Is your third-party biller or third-party contractor, are they going to send in the documents directly to the payor or the contractor, or are they going to send it to you first? You want to make sure those provisions are outlined in the contract. Who's responsible for coding and making sure that all of the information is accurate on those claim forms before they're submitted to the payor? Who's going to ensure that you're maintaining HIPAA compliance? Especially if you have those third-party groups engaging with those business associate agreements. And then finally, any insurance responsibilities, such as cybersecurity insurance or E&O. And like I talked about earlier, legal defense insurance. A lot of your insurers these days will have provisions or opportunities in your insurance contracts that they're going to be able to provide some sort of legal defense fund for you up to a certain amount. Next slide. Some other provision examples, the rights of a billing company, if you are utilizing that third party to come in and conduct some periodic on-site visits just to make sure that your team is accurately coding and performing the services that then the biller is coding and documenting and then submitting to the payor. Who's responsible for maintaining secure communications and making sure that you have HIPAA compliant secure communications. Like I noted just a minute ago, establishing those business associate agreements for your billing company and any other third party who might be handling, PHI. Who's responsible for the billing the claims if there's insufficient information to support the coding that's involved. Any indemnification clauses. And then finally, if you want to add a compliance addendum that provides, for such activities as who's reviewing each party's compliance program, periodic communications and meetings between the two parties to make sure everyone's doing their jobs right. Kind of being able to audit, both the third party and the third party to be able to audit you. So, a lot of times with these contracts, you kind of really want to make sure that you're having outside legal counsel review them, just so it can protect you, whether, when you are engaged with that third party, but also to protect you, from any government auditor or private payer auditor who comes in. Because a lot of times what's going to happen is going to be spelled out in the four corners of that contract. So you want to make sure that they're robust enough to cover, as many potential situations that you're likely to experience when you're engaging in, home health and hospice operations. Next slide. Okay, now I'm going to turn it over. I'm sorry, one more slide for me. Just kind of wrapping it up with developing, your billing in any other kind of contracts. With billing agreements, using Medicaid or will pay the provider, except if you reassign your NPI. And then you have to know that, billing agreements are going to be state specific. They're going to be 50 states plus DC, so they're all going to have their own specific laws that are going to affect billing agreements. So, if you're operating in Louisiana, but you might have an offshore biller, you're going to have to make sure, and when I mean offshore, that could be outside, CONUS, the United States, or, if you have a biller operating, let's say in Texas, you're going to have to determine which state's laws apply. And, offshoring of data, I just mentioned, Louisiana doesn't explicitly prohibit the offshoring of data, but Medicaid has program requirements that kind of ensure there are strict requirements of what must go on. So you really want to make sure that, again, you're having legal counsel review a lot of your billing contracts to ensure that you're protecting yourself going forward. Next slide. Okay, now I'd like to turn it over to my colleague, Heidi, who's going to start with some of these post-payment reviews.
Thank you, Robert. Okay, so let's talk a little bit about prepayment reviews. And again, remember that the entire point of this presentation is building from the baseline. All of this assumes that you've already got a compliance program in place, and now we're doing things to strengthen it and make it better. So one of the things that you need to be thinking about is prepayment reviews, ADRs, post-payment reviews, and suspensions. And as I think Rob alluded to earlier already, and certainly in the compliance program guidance, when you get an audit request, you should be reviewing the documentation, the claims forms, and the supporting documentation before you send it in. And the big issue is always, as we've said a couple of times already, is was the care medically necessary and is it sufficiently documented? So when you have any of these kinds of actions, you want to be very carefully looking at this documentation before you turn it over with all of these other aspects here. And again, as Robert said earlier, make sure you keep a copy. Things do get lost. We have all had that experience, and your attorneys are going to ask for copies of these as well. So make sure you copy them and run through this checklist before you turn over any documentation. Next slide, please. So if you have particularly post-payment audits, post-payment audits usually require a significant amount of additional documentation. So if you have a billing company, you want to include things in your billing company that address who is going to be assisting in pulling and analyzing and submitting the additional documentation. Now, if you do your billing in-house, that's fine. You're not going to a billing company, but still, you need to figure out how you are going to have the staffing necessary to do this. Most agencies run pretty lean, and so, you know, the extra time is going to come out of somebody's other duties. How do you figure out who is going to provide this effort, and what are you going to do to cover the rest of the duties? Again, for post-payment, make sure you review the claims and the supporting documentation before you send it in. Now, because the appeals process can take so long, it is very, very likely that the amounts that the payer says you owe back, it's very likely that they'll start recouping them. And so one of the big questions is, how are you going to survive if they start recouping their payments? It's probably not as critical if you have a small recoupment, but earlier this year, I had a recoupment where it was looking to be on the order of almost $1 million. Can your agency survive if you are having to have a recoupment of $1 million over the space of a couple of months? You really want to think about that. And if you're using a billing company, you know, you want to have things in your contract that can address whose fault is it if the claim is improper. You know, and are you going to allege that they are improper? They are at issue for providing incorrect or improper advice. There's a lot of considerations with that. Also, do you have E&O or errors and omissions insurance? Again, this is different from your general liability insurance. Errors and omissions can provide additional coverage, and again, very different. So it's something you may want to consider having there, because again, it could provide additional protections for you. And as Robert said, don't forget that if you identify something through an internal audit, you have to repay it within 60 days. 60 days is not a whole lot of time. And again, if there's a lot of money at stake, this is where you might want to reach out to the payer and negotiate some sort of a repayment plan with them. Next slide, please. Suspensions. All right, so a suspension of a provider usually follows a quote-unquote credible allegation of fraud. I have actually seen credible allegations of fraud be very, very thin at best. And what happens is this can often, especially for home health agencies, be a ripple effect from other providers being investigated. So a number of years ago, we had a Rockwall doctor here in Texas who was indicted in a healthcare fraud scheme, and it resulted in the suspension of 78 DFW area home health agencies who had gotten referrals from this provider. And all of these suspensions were based on the quote-unquote credible allegation of fraud. So one of the things that you always need to think about is, if you are being suspended, is why? Where is this coming from? And the payers might not necessarily tell you, so you may have to suss this out yourself. Similarly, if you know that you have a referral source or somebody that you are working with that has been investigated or suspended, again, you should really anticipate being perhaps, at the very least, get a document request to demonstrate, because the payers are going to want to see if you're engaged in the same bad act as that other entity. So think about all of these things very carefully. This is very much the case where the government takes the approach that birds of a feather flock together, and you will be tarred with the same brush as somebody else. So a little bit more about the mechanics of a suspension. It is usually 6 months minimum. Again, can you survive that long if you have been suspended? And it can be renewed for another 6 months, and then another 6 months, and then another 6 months, and so on. Always renewing for 6 months at a time. I have seen several providers go out of business because they are suspended. They are maybe not entirely, but majority of their revenue comes from somebody like Medicare or Medicaid. And when that payment source dries up, they have no other payment source. So while you are suspended, you can continue to see and treat beneficiaries, and you can continue to bill, but what's going to happen is any approved reimbursements are going to go into an escrow account. And again, you will not see a red cent of that until the question is resolved. And if it is resolved in your favor, then the funds will be released from the escrow account. Otherwise, they will not be paid out at all. So again, this can potentially trigger a cash flow crisis. So can your entity survive if you have a credible allegation of fraud and you are placed on suspension? Next slide, please. All right, moving up sort of the risk ladder in terms of subpoenas, search warrants, and investigations. As we said earlier, what you want to do is you want to get a copy of the relevant document, and then call your attorney ASAP and provide a copy of that document to the attorney. This is not something you want to handle on your own. There are some pretty strong legal implications, particularly if you have a search warrant. If they want to put the resources to show up on site, there is something seriously going wrong. So you want to make sure you get your attorneys involved ASAP. If it's a subpoena, you may have a little bit more time to respond, particularly the subpoena ducis tecum. That's just a fancy word for a subpoena to turn over documents. Again, you want to have an attorney involved in this because there may be privileges and protections, and your attorney can help you work through mechanics of how and when to respond, and can perhaps do a rolling production or whatever. Again, if it is a search warrant and somebody shows up on site, big issues. So one of the first things is do not get in the agent's way. You don't need to help them look for what they are looking for, which will be identified on the search warrant, but you can't obstruct. Make sure to take notes of exactly what they take. They will not give you the opportunity to make photocopies of things or to duplicate a computer drive or whatever. So again, if you don't have a business interruption contingency plan and backups, do so now. Often you'll want to release a public statement. Again, you want to have your attorney do this, and you want to train your staff to deal with questions from clients and the public. The last thing you want to do is have the front desk receptionist say, oh yeah, they came and got documents because they say we're billing improperly and we're engaged in healthcare fraud. That's not an appropriate response. And do not give interviews. There is nothing that can be gained from doing interviews. I have seen numerous situations where a provider has a TV reporter's microphone thrust in their face, and they say things and they inadvertently admit to things that they should not have admitted to. And here's another example. So this is the Merida Healthcare Group in Texas. The allegation was that the licensed physician received kickbacks for referring hospice patients. When the investigation began, he called up the individual who was, in fact, giving the kickbacks and told that individual to lie to the FBI if the individual were interviewed by the FBI. And when the physician was then interviewed by the FBI, he too lied and denied accepting kickbacks. And as a result, there were various indictments and trials. You don't want to lie to the FBI because if you do make a false statement, in addition to the underlying conduct relating to your provision of health care, you can go to prison just for making a false statement. And again, this is a federal felony. Even if you're cleared on the underlying conduct of the healthcare problems, if you lie to the FBI, it's a federal felony, and yes, it will follow you for the rest of your life. Next slide, please. Which leads to our another fun topic, exclusion. So what is exclusion? Well, Medicare and Medicaid reimbursement is not a right, it is a privilege. And so the government always retains the ability to exclude or sanction individuals who have been found to engage in a variety of bad acts. I'm not going to go into the list of them. If anybody wants to see the list, you can go to the exclusions.oig.hhs.gov, and they have the exclusion authorities listed there. But long story short, what you want to do is you want to be checking your exclusion lists on a monthly basis. And this is for federal and state Medicaid. That is required by law or regulation. I will also note in here that many private payer contracts also have provisions that require you to check the exclusions lists. So if you say, oh, I don't have any Medicare or Medicaid patients, I'm strictly private pay, not good enough. Again, your contracts probably require you to check exclusion lists. So you'll want to be checking at least the 3 exclusion lists, the federal OIG, LEIE, the GSA's System for Award Management, or SAM, and then Louisiana also has a state database. Some private payer contracts do require you to check the exclusion lists for all other states, and there are currently 42 states that have databases of excluded individuals and entities. The way I categorize this is it's kind of like mowing your lawn. Can I mow my lawn? Absolutely. Do I want to mow my own lawn? Not so much, especially in summer. Once you go beyond 3 databases and about 10-ish employees or people, independent contractors that you might be hiring, it very quickly gets to be a pain in the you-know-what. And at that point, you should probably consider a subscription service. We have resources for people to do that. So if anybody's interested in that, let us know and we'll hook you up. If you do your own checking, save your own screenshots to prove that your employees and contractors are not on any of the lists, and keep this with your important documentation. And finally, remember that exclusions don't expire. So you can be excluded for, say, a 3-year or a 5-year period, but once that period is up, you're not automatically reinstated. An individual then has to apply for removal from the exclusions list and apply for reinstatement for the federal programs. The time bar is simply the period when the government agency, the OIG, will not even consider a reinstatement request. And again, you must have the written approval from the OIG that the individual or the entity has been reinstated. Otherwise, you cannot hire them or contract with them. So, very important to do your exclusion screening, and many entities do not do it. It is a mistake to not do it. Next slide, please. This is just the OIG's Special Advisory Bulletin from 2013, sort of talking about what the effect is of an exclusion. And we have highlighted in red that an excluded individual may not provide any types of administrative or management services, such as billing or accounting or training or human resources. I have actually had a case where an individual was excluded. She has lost her licensure as an RN. Long story, won't go into the detail. But she was then hired to provide some back office services, and the OIG, through doing an audit, realized that she had been hired, and that healthcare provider ended up paying back about $60,000 in penalties to the OIG for having hired an excluded individual. Again, she wasn't providing specific services to patients. She was sort of hidden in that there was nothing specifically tied to her. But yes, you can get into a lot of trouble for that. Next slide, please. So what do you need to do? Again, you want to check the LEIE, the SAM, and the state exclusion list for each employee when you hire them, and then you should be doing all current employees and contractors every 30 days. You want to retain this proof. And if you're contracting with somebody, you want to have a provision in your contract that places a similar responsibility on any of your contractors to do exclusion screening on their employees and subcontractors, and that they maintain the documentation of that as well. If you actually use or hire an excluded individual, again, you should consult or hire an attorney, because there is a process to deal with this. Likely, they will advise using the voluntary self-disclosure protocol. But there are many considerations in that, and you really want to have legal counsel while you're doing that. And finally, if you have an excluded employee, they could potentially taint every claim filed since their hire, creating an overpayment. So for example, if you have a licensed individual, a nurse or a physician or a therapist, and it is very clear which patients they have worked with or touched, then those specific claims are considered tainted and very easy to determine how much is returnable versus via an overpayment. So you want to very carefully think about that. And again, if you have any kind of other individuals, there are methods that the OIG utilizes to figure out how much your overpayment is. Again, so the OIG actually tells you up front that you can reduce any liabilities if you demonstrate that you checked the LEIE or your other sanctions risks to make sure that the individual wasn't excluded. Next slide, please. Okay, these are two specific cases. Since we're running a little short on time, I'm not going to go over them. You can read them at your own leisure. But again, they demonstrate the importance of all of this exclusion. And again, case number 2 is where the state itself sought its own damages under state law and not just the federal law. So again, very important to make sure you are doing your sanction screening. Next slide. I want to touch real briefly on Stark and anti-kickbacks. Most of you know these because you've got a compliance program, but just very, very careful about these. Stark and anti-kickback, the government is applying these in new and different ways. In particular, if you're using a billing service, again, there's some cases here. I'm not going to go into them in detail, but if you're using a billing service, you want to think about how the Stark and the anti-kickback statute apply. And in the case of home health and hospice, again, often you get referrals from physicians. Think about how those might apply and how you can really work with program and your staff, and so make sure you don't violate them. Next slide, please. There are self-disclosure protocols that if you have run into an issue, so for example, kickbacks, Stark, use of an excluded person, those kinds of things, there are processes. Again, you will want to be working with an attorney on these because there are lots of considerations and potholes to doing a disclosure. Note that self-disclosure is not for a straight overpayment or an error. Those, again, you should just pay back to the payer or the MAC or the Medicaid program. And again, you only have 60 days to pay those back. Just be aware that if you just go down the road of a self-disclosure, you are likely going to be required to sign a corporate integrity agreement. The thing with the corporate integrity agreement is that's a contract with the government where essentially you are required for a number of years to do certain things you should be doing already anyway, but then you'll have to submit reports to the government and be subject to audits and certain performance measures until your corporate integrity agreement is resolved. So yes, that's why you want to work with an attorney, because there's lots of considerations in a self-disclosure. Next slide, please. Moving right along very briefly. HIPAA, the basics. I am actually shocked at how much HIPAA non-compliance there is out there. Most people just focus on the privacy rule and they forget the security rule. The security rule requires all covered entities, and if you're listening to this webinar, you are most likely a covered entity. It requires them to complete a security risk analysis, yet 90% of small providers have never done a security risk analysis. And this is the most common deficiency when a breach occurs. The leaders of OCR have harped on this repeatedly in the speeches and presentations that they give. And a security risk analysis is not a one and done. It has to be repeated periodically, preferably annually. If you do not know how to do a security risk analysis, again, reach out to us. There are resources out there that you can do them. But again, this is kind of like the exclusion screening. I think it is something that you can do, but you might not necessarily want to do yourself. To do it properly requires a lot of information. And again, my finding is that most providers really don't have the sufficient knowledge or the bandwidth to be able to do a proper security risk analysis. In conjunction with the security risk analysis, you have to have a risk management plan. This is also required by the security rule, and you cannot do this until you have conducted a security risk analysis to identify your risk. And since you're updating your risk analysis, your risk management plan should be updated periodically as well. You'll want to have policies and procedures that are specific to the HIPAA security rule. I am in many offices, and what people say is, oh yeah, I have this manual. It tells them our employees when they can clock in and so on. Folks, that's not a HIPAA policies and procedures manual. The employee handbook is not a policies and procedures manual. The other thing that we find is people copy something from the internet and it is not applicable to their particular circumstances, and it is very much not personalized. So buyer beware. If it's free, it probably is not appropriate to you. Training. Most providers are actually pretty good about basic HIPAA training, but again, this is not a one and done situation. You need to be training periodically, like every year. A couple of things. Updates are coming to the HIPAA security rule. Yesterday, OCR notified or put a thing up on their website that they have submitted new regulations to the Office of Management and Budget, which is a preliminary step to publishing preliminary rules, and they are hoping to publish a new proposed security rule updates by the end of the year. So there are updates coming to the security rule. You guys need to get your houses in order. Also, OCR has said they will be starting random audits in 2025 to assess HIPAA compliance. And again, they're going to look for at least the 4 things up above: a security risk analysis, a risk management plan, policies and procedures, and evidence of training. If you do not have this, you have a window to get this into place. And again, you can do some of this yourself. Some of it is not so easy. If you have questions, reach out to us. And as a case example, late last year, we had the Cascade Eye and Skin Centers. They paid OCR a $250,000 penalty, and after they had a breach, and that is because they had never done SRAs, they did not have a risk management plan, and they did not have policies and procedures manual. Notice they had done training, but the rest of it was missing. Next slide, please. Business associates. The HIPAA privacy rule requires all covered entities to have signed business associates. We often do not see business associates with people who are in fact business associates. So make sure that your BAA does include the updated language from 2013, and also beware of state requirements as well, and again, any private payer requirements. You may have more business associates than you realize. Any of your subcontractors are going to be business associates, and you don't want to rely on their business associate agreement. Theirs is written to protect them, not you. You need to have your own business associate agreement. And for you all, make sure that you can fulfill your responsibilities under the BAA. Again, we have providers who may not be the covered entity, but who contract with the covered entity. You all need to understand what it is that you are agreeing to in a business associate agreement. And here's another case example. Blackhawk Consulting Group was providing billing services for Advocate Healthcare. Blackhawk was hacked, PHI was accessed, and when they investigated, there was no signed business associate agreement between Advocate Healthcare and Blackhawk. Advocate was then charged with impermissible disclosure of EPHI. And Advocate, with this and 2 other breaches, ended up paying $5.5 million. So you want to, again, make sure that you have business associate agreements in place. Breaches, very quickly. I'm moving on as quickly as I can. I know we are over. Next slide, please. So if you have breaches, you have to do a 4-factor analysis. Again, if it is a business associate that has a breach, they have to notify you without unreasonable delay and within 60 days. Remember that if more than 500 patients are affected, the covered entity has to report this breach to the OCR without reasonable delay and no later than 60 days after discovery. If there's more than 500 patients, you have to notify local media, and you have to notify affected individuals. If any of you are aware of the Change Healthcare breach, which we're still having fallout from that from February, I actually myself about 2 weeks ago got a notification that my data was accessed in the Change Healthcare breach. Because Change Healthcare was a clearinghouse for many, many providers, the estimates are that about 1/3 of all patients and claims in the United States have been affected. So there's probably a large likelihood that some of you on this call will have been affected by that. Stay aware of it. And again, the burden of the proof is on you and the business associate to demonstrate that all HIPAA requirements were met and that the disclosure was not a breach. There's the 4-factor analysis mentioned above that you will use to assess whether or not the breach was an improper disclosure. I won't go into the details again because we're over time. But again, here is another case example of a breach. You want to be taking HIPAA stuff very seriously, especially since OCR has now gotten additional funding to ramp up investigations and audits. Next slide, please. This is just the penalties that may be assessed. There's 4 different tiers depending on how much knowledge you had and how willful there was in terms of neglect for the reason of the breach. And so just make sure you understand what is here and what is at issue. Note that there is a minimum fine for intentional and uncorrected release of PHI. This is a situation, for example, where you have an individual, possibly a workforce member, releasing PHI. There's all kinds of circumstances that would occur this, but again, it's a $68,000 minimum fine. And the question is, can your agency survive a $68,000 fine? So folks need to really be taking HIPAA pretty seriously. I think people have thought, oh, I have a notice of privacy practices. Yeah, I've got some stuff in place. I'm good. But I think what we're starting to see is much more enforcement on the HIPAA front. So you really do need to be taking this very, very seriously. Next slide, please. Patient abuse or neglect. Be aware that you are required to report patient abuse or neglect. And HIPAA is not an impediment to reporting abuse or neglect. People who make these reports in good faith are generally immune from civil or criminal liability for those reports. So just remember that that is an obligation out there as well. Next slide, please. All right, wrapping up here. So what you want to do is, again, figure out what you have an issue. In many circumstances, you really do want to hire legal counsel. It doesn't have to be us. Make sure you just have legal counsel who knows what they're doing. This is not the time to hire your sister's brother-in-law's nephew who does traffic tickets and general wills. Many of these issues are complex, and with all due respect to general legal practitioners, they are often not aware of many of the issues that are out there and the implications of them. The thing about hiring an attorney is you get attorney-client privilege. That is often something you really want to have, because if bad facts develop, it gives your attorney the opportunity to either limit disclosure of them or figure out a strategy for when the information comes out. Legal counsel can also just more generally provide strategy in terms of preservation of documents and emails, employee interviews, and figuring out if you have overpayments or any other issues, what the implications of those are with your business, and if you have to do additional work to determine the extent of the. If you have potential fraud, you're definitely going to want an attorney, because again, you're going to be dealing with the government. You really want to be represented if you're dealing with the government. And if you've got a billing company, again, you want to have legal counsel involved, or not just a billing company, but a third party. Their interests are different from yours. You want to make sure your interests are protected. Again, doesn't need to be us. Make sure your attorney knows what they're doing. Next slide, please. All right, so I apologize that we ran over. Alex, we can be on the line for a few more minutes if there are questions from anybody.
Oh, no, I don't see any questions.
All right, well, thank you all so much for sticking with us. I know we ran over, and I apologize for that. There's a lot of information here. Go ahead and if you have any questions, please feel free to contact us. If you go on our website, our emails are there. And again, you can contact us through the telephone numbers here on this slide. Thank you so much all for sticking with us, and I hope you all have a good day. Robert, did you want to add anything?
Nothing to add, but if there's anyone who listened to the presentation who's going to be at HCLA's conference next week in Baton Rouge, I will be attending, so it'd be a pleasure to speak with you in person, and if you have any questions, you can ask me there directly.
Awesome, yes. go folks, go meet Rob, and he's always happy to chat about these issues.
Thank you all for attending.
Thank you all.
Thank you so much. Thank you so much to our presenters, and thank you to all of our attendees for joining us today. I'll be sending a copy of the PowerPoint slides tomorrow, and if you have any further questions, definitely feel free to reach out to them. Hope you all have a great Tuesday.